10 Early Sign of Autism. Autism, also known as Autism Spectrum Disorder, ASD, is a neurodevelopmental disorder that affects communication and social interaction. It is a spectrum disorder, meaning that it affects individuals differently and to varying degrees. Early signs of autism can be difficult to identify, as they may be subtle and vary from child to child. However, some common early signs of autism include delayed speech or language development. Children with autism may have difficulty with verbal communication and may not begin speaking at the same time as their peers. They may also have trouble with nonverbal communication, such as making eye contact or using gestures. Repetitive behaviors or interests. Children with autism may engage in repetitive behaviors such as rocking back and forth or spinning objects. They may also have intense interests in specific topics or objects. Difficulty with social interactions. Children with autism may have difficulty with social interactions, such as understanding and using nonverbal cues, initiating conversations, and understanding the perspectives of others. Lack of interest in playing with others. Children with autism may prefer to play alone or with objects rather than interacting with other children. Lack of response to their name. Children with autism may not respond when their name is called, even if they can hear it. Lack of interest in typical childhood play. Children with autism may not be interested in typical childhood play activities such as playing with toys or playing games with other children. They may also have difficulty understanding the rules of games. Limited range of facial expressions. Children with autism may have a limited range of facial expressions and may not use them in a typical way. Limited interest in socializing. Children with autism may not initiate social interactions with other people, and may not respond when people try to interact with them. Stereotyped or repetitive movements. Children with autism may engage in repetitive movements such as flapping their hands, rocking back and forth, or spinning objects. They may also become fixated on certain objects and want to hold them or touch them constantly. Sensory issues. Some children with autism may have heightened or decreased sensitivity to certain stimuli, such as light, sound, or touch. They may also have difficulty processing sensory information. It's important to note that these signs may be present in other disorders as well, and may not necessarily mean that a child has autism. It is always best to consult with a healthcare professional, such as a pediatrician or developmental pediatrician, who can evaluate your child and provide a diagnosis. Diagnosing autism early is important because early intervention can lead to better outcomes for children with autism. With the right support and interventions, many children with autism can learn to communicate and interact more effectively, and lead fulfilling lives. It's also worth noting that, while early signs of autism are often observed in the first 2 years of life, some children may not receive a diagnosis until later in childhood. Some children with autism may not be diagnosed until later in childhood or even adulthood, as the signs may be less obvious or they may have learned to compensate for their difficulties.